Hey, and welcome to another episode of Hiss and Tell. Today I'm joined by Dr. Federica Pirrone, an ethologist and professor at the University of Milan. Her research is helping to change how we understand aging, cognition, and emotional health in cats. Join us as we dive into her groundbreaking work on how stress and low-grade inflammation affects feline cognition as cats age, why cats are often overlooked in this research, and what subtle behavioral changes we as guardians should be paying attention to long before cognitive dysfunction becomes obvious. Here we go. Hi, and welcome to another episode of Hiss and Tell. I am your host, Christina Wilson, and with me today is Dr. Federica Pirrone. She is an ethologist and professor at the University of Milan. Welcome.
Thank you. Hello, everyone. I'm so excited to be here.
I'm excited to have you. Can you tell me a little bit about who you are and what you do?
Yes, I am an ethologist, so I study animal behavior, particular pets, so cats and dogs, but not only those species. And I work at the University of Milan, and I'm collaborating with a few teams in the US. So the research we will be talking about has been carried out with them, with Professor Carlo Siracusa from the Penn University.
Okay.
And his team.
Cool. So the paper that I wanted to talk with you about today is called Measures of Spatial Memory, Peripheral Inflammation, and Negative Emotional State Predict Social Cognitive Skills in Healthy Aging Cats. For everyone who is listening, that is quite a mouthful, but I will put a link to it on the website page for this episode. If people want to download and read it, I recommend it. It's a very interesting study. So can you briefly kind of summarize what led you into researching cognition and stress, inflammation, and aging in cats? Like, what gap did you see in the research?
Yes. Well, it all started with a simple observation. That is that these factors, cognition, stress, and inflammation, are connected. They are interconnecting during aging in every individual. But most of what we know comes from humans, animal models, like small rodents, and a bit from dogs. We are studying the same thing in dogs as well.
Mm-hmm.
But cats have been largely overlooked in this field. So that's not just a gap. The point is that that's a huge black hole in cat health and well-being as they age. And if you consider that there are about 600 million pet cats in the world, then in the US you have like 100 million. Here in Italy we have about 10 million, but they are a lot. If you consider that 20% of these 600 million pet cats are classified as senior, which means that they are at least 7 years old. So it's not about one or two cats. It's about millions of pet cats who deserve much more scientific attention. That's where we started. And that's what the hole we wanted to fill.
Of course. And one statistic that I noted from the paper itself was that 28% of cats who are between 11 and 14 exhibit cognitive dysfunction, which, I mean, that's a huge amount. And I think to most pet owners, that doesn't even seem like a super old cat. So I think that's an important number for people to realize. Can you talk a little bit about what that cognitive dysfunction might look like?
Yes, cognitive dysfunction might look like changes in how the cat behave. These changes can be very subtle at the beginning, so you don't really talk about dysfunction when only small changes appear. That's normal aging, okay?
Right.
Everything reduces in an organism that ages. So everything, all the functions, all the organs, everything shrinks. So cognition as well. Little, moments of disorientation. The cat looks like gives up a little bit earlier than before, sleep differently. Maybe the cat sleep less or even more. The cat may appear a little bit less motivated than before. It all like a matter of change. This is what you can expect from your aging cat who is slowly declining in their cognitive function. When all of these signs become intense or more frequent and start affecting that cat quality of life and ability to adapt to the environment,
right,
the usual environment, the home environment, that is the point you can start thinking those changes turn into a dysfunction. But there's time before that to happen. So there's time to intervene.
Got it. Yeah.
But there's a secret.
What's the secret?
The secret is to detect those signs when they are so slight, and that's not easy. If you know cats, I know you know cats probably better than me.
No.
And probably all the people who will watch us know cats. So all of us know that cats don't display that much.
Right.
So
They're
not
subtle.
And that's the real difference between cats and other species, because the mechanisms are the same. The biological mechanism of aging are the same.
Yeah.
But cats are different because they don't display. So it's even more difficult with cats than with other species to detect those changes when they have just begun, when
It's true.
Slight.
It's very true. I remember watching our cat Pumpkin, who lived to be 22, which was amazing. But the last few years of her life, she had dementia. But it did start in those ways, which I think for 22 is okay. And she didn't seem distressed. But she definitely changed where she slept at first, very subtle things, how much she would eat, where she wanted to eat. There was more vocalization. She had always been chatty, but it went up. And then she also started to stare at herself in the mirror.
Yeah.
It was a big thing when it really kicked in, and she would look at herself just like, "Who's this lady?" I think she was no longer sure exactly what her reflection was, but it was because it didn't seem to disturb her. It was almost a little funny to watch her. She'd give herself this grumpy look, but it was an interesting process, as sad as it was, but she also lived a long, great life, to see those tiny changes and then to see them really escalate, like funnel out into these big dramatic things that then anyone could see. But they did start from just these tiny little things where you'd be like, huh, that's different. And I always tell clients, anytime you have those moments where you're like, huh, that's different with a cat, it's actionable, because it's generally something strange is going on with your cat if they're changing their behavior, because they're such routine-based animals. So anyway, going away from the tangent that I just went on, in your study, you used privately owned cats in their home environment to look at spatial memory and social cognition and stress behaviors and inflammatory markers. Can you tell us a little bit about that study and what the key findings were that you'd like our listeners to know about?
I think that listeners should remember that aging comes with more social flexibility. This is something we have already seen in dogs, and now we've seen in cats as well. But this is true if they're healthy, as in our case. In fact, in our study, older cats showed better social cognition performance, which is probably related to a kind of wisdom. Older animals, older people, or the dogs and cats are wiser than younger ones, probably because they could learn from past experiences. Even with their caregivers. In our study, maybe we will talk about that a little more in details. It's were tested with a caregiver present by the caregiver, actually. So the social cognition was measured toward their caregiver. Another thing very important thing that we observed is that a pro-inflammatory marker like interleukin-1 beta, which is the one we measured, itself didn't show any negative effect on social cognition. So it's not a matter of old age and inflammation individually. It is when you look at the interaction between these two factors together, older age and higher interleukin-1 beta levels, then social flexibility, social cognition decreased. In other words, older cats in our study, I could say, so cats who are older, okay, and are also more inflamed, show less social flexibility, when social flexibility would be the successful strategy, which was the case in our study.
Right.
They were involved in a task in which they had to use a social cognition, what we call referential communication, to solve a problem. And that's what we measured. And the older one, who had higher levels of inflammatory one or pro-inflammatory marker were the ones to perform worse in that task. And even when they were stressed, a similar pattern was observed with stress behaviors. Overall, our cats were not stressed, but those showing more stress behaviors were also more likely to perform worse in social cognition. And this is something that the caregiver should really keep in mind. What I forgot to mention before when I said, and that was important to say, when I talked about the interaction that we measured, the effect on deteriorating social cognition of the interaction between the old age and inflammation. Okay, that told us that we were in the context of what we call inflammaging.
So can you explain a little bit more about what inflammaging means, what it means in the feline context and how it links to behavior and cognition?
Yeah, of course. Inflammaging, inflammaging is a process which is basically very similar from a biological point of view, in physiological point of view, in cats, dogs, and other species. The term tells us that there are two key concepts put together: inflammation and aging. Okay, that's the term inflammaging. It means that at the individual level, chronic low-grade unresolving inflammation develops even when there is no evident disease. And we're not talking about peaks of inflammatory markers or organs that are strongly inflamed. It's more like a low-level persistent state, something subtle that reaches the brain. It can reach the brain directly because some of these markers, like interleukin-1 beta, cross the barrier, the blood-brain barrier, so they can reach the brain and affect it directly, or through in an indirect way through special mechanism of signaling.
Mm-hmm.
So once the inflammation reaches the brain, we talk about neuroinflammation, and this is when it can affect behavior and cognition, leading, for example, to slower memory or lower motivation, even in an aging cat who is apparently healthy.
Right. Okay. So in the paper, in your experiment, you had cat owners use a food-baited container in this spatial memory task, and then also also the unsolvable task to look at the social cognition and the gaze alternation. Can you kind of describe what the cat's responses tell us?
Yes, of course. We use food-baited container in both the tasks. We tested spatial memory. In this task, the cat was required to remember in which container out of 5 he just seen put like 30 seconds before, because
Mm-hmm.
the cat see the caregiver putting food in one of 5 containers. Then we repeat the trial for 5 times, and then hold the cat, turns around so the cat cannot look at the setting, and for 30 seconds, because we want the cat being able to recall. Okay,
Right.
then the cat is let free, and if the cat goes straight to the container, to the right container, the one he's seen being baited, that is a correct answer. And so that tells us that the cat remembered exactly where the food was placed.
Mm-hmm.
And as for the unsolvable task, as for the social cognition, we use what we call unsolvable task. Again, we have a container baited with food, but in this case, the container is sealed. So we know that the cat cannot open the box, the container. Right. So what we at is the behavior of the cat, who is expected to try to solve it. And then once the cat understands that the problem is not solvable we expect the cat to try to look around, to go outside with their attention and interest outside of the box and look around and look at the caregiver. That's social cognition, but not just look at the caregiver. What we expect is to see the cat turn toward the caregiver, staring at the caregiver, and looking back at the object, and at the caregiver again, then at the object, alternating the gaze. Okay, which tells us that the cat is trying to seek useful information at least, maybe even help, okay, from the
Right.
caregiver. That would be the only successful strategy in that case. So cats who stop being persistent over the object before, earlier,
Mm-hmm.
are those that are more flexible in their thinking, which is in their cognition.
Okay, so you found a higher serum of the pro-inflammatory marker was associated with a reduced gaze alternation, especially in those older cats. So why might inflammation impair that kind of cognitive social behavior?
Because, as I said before, it affects the brain and
Right.
neural communication, which become basically less efficient. So animals may be less motivated, less able to process complex cues.
Mm-hmm.
And as a result of inflammation, an older cat may simply start to find it harder to read social situations or switch strategies when facing a challenge, where those strategies would be the most successful.
Right. That makes sense. And you also noted in the paper that stress related behaviors predicted poor social cognitive performance. What kind of behaviors did you classify as stress behaviors in the study? How might cat owners recognize stress behaviors in their cats?
Okay. Yes, we consider subtle signs which might indicate stress, like nose licking,
Mhm.
yawning, eye closure, blinking, painting, vocalizing a lot, of course,
Yeah.
and or frequently in a repetitive way. Head or body shaking. These were maybe something more, but these were the ones I remember the most significant.
Right.
What I want you to know, to consider, is that these are all normal behaviors, okay? But I mean, if you see a cat nose licking, that's fine, okay? But when a cat starts showing them more frequently or more intensely or for longer periods of time, that can indicate that they are a bit overloaded, emotionally overloaded. They are experiencing a state of tension or frustration, maybe.
Mm-hmm.
So, how can caregivers recognize them? Well, I should say simply by keeping an eye on their cat. So the key message is that if a cat is getting older, and so the cat is 7 years and or older, okay, and starts hiding more or showing these subtle signs more often or more intensely or for longer periods, it may mean that the cat is emotional overloaded and their cognitive performance could be affected as well. So what does this look like in everyday life? Well, the cat may seem, probably I said that before already, the cat may seem to give up more easily than
Mm-hmm.
before, appear slightly disoriented at times, or show reduced motivation. And that's really a signal that it's time to better support that aging cat.
And how would owners better support the aging cat?
Well, for example, keeping their environment predictable,
Mm-hmm.
not stimulating, okay? Because boredom is not good
Yeah.
to stay young, okay?
Yeah, I think for all of us, we should all take that
Yeah,
lesson. Yeah.
yeah, it's the same. It's the same. So
Yeah.
we don't have to overstimulate a cat getting, frail, but offering some, play opportunities, maybe for short periods of time,
Mm-hmm.
some easy problem solving like food puzzles or things like that, but also keeping the daily routines and providing safe hiding spots. This is very important because can help reduce stress, and we've seen that stress can impact on cognitive function in an aging cat.
Yeah.
Then they should consider diet. Diet can also play a role. Maintaining a healthy weight and providing balanced nutrition can help counteract inflammation, for example. But also cognition. You've seen, I don't know if you know that. I'm spoiling it. Probably, maybe if you want, we can meet another time, because
Yeah.
another paper, the second part of this study, just came out. Just one second, because the title is long again.
Okay.
And I don't remember that. Just to let you know, so that the title is "Variations in Body Condition Score, Inflammatory and Metabolic Biomarkers Predict Cognitive Changes in Clinically Healthy Senior Cats," which is the second part. So body condition score is a came out as a very important factor, in modulating all these cognitive aspects in the aging cat. And of course, another thing that gardeners should do is be sure that senior cats get regular vet visits, even if they seem fine. That's the point.
Yeah, it's funny. One of my best friends is an amazing vet. We love her so much. She's the best vet I've ever met. And one of the hardest things that she talks about is getting people who have cats to bring them in. Like, she says that dog people bring their dogs in, but cat people are just like, the cat seems fine, so she often doesn't see the cats until there's a problem with the cats. And especially people with senior cats don't understand that senior cats need to come in at least twice a year, not just
That's
once.
Important.
Yeah,
That's important.
Yeah, so I want to just put that out to everyone listening. If you have a senior cat, try to get your cat in there twice a year. I know that often cats don't want to go, but you can carrier train them. You can, make it so that they maybe not enjoy the vet, but it's not like a torturous process. We have a lot of older cats in the house, so I'm just like, there's a constant, yeah.
I have two cats and they're old. The two of them are old, so.
How old are they?
10 and probably 14 or 15.
Yeah.
Because Dentone, Big Tooth, was a rescue cat, so we don't really know.
You don't know,
We're
yeah.
not sure, yeah. But could be like 13, 14, something like that.
So one of the implications from the study was that even in cats that are healthy by vet standards was that you're seeing early cognitive shifts that are linked to inflammation and stress. So how can we interpret that in practical terms? Is there something that people should be doing?
Yes, the point is that cognitive changes are among the earliest changes to develop with age. Mm-hmm. And at first, they tend to be subtle and may not interfere with a cat's ability to adapt or with the cat's overall quality of life. That said, as with all age-related processes, even cognitive changes are expected to progress and can eventually become dysfunctional. So the evidence that stress and inflammation can negatively influence this process, essentially fueling it, means that in practical terms, we should do everything possible to reduce stress and inflammatory load in aging cats, even when they are considered clinically healthy. We know that these changes progress, okay,
right.
because that's the normal part of aging. It's a progression, but so they're not stoppable. Okay, yeah. These changes are not, but they can be slowed down. If we support the cat when changes are very subtle, when they are right at the beginning, we can slow them down. So the cat will have a longer health span, okay? Yeah. Which is a longer life with a high quality of life, which is the goal.
Absolutely. So I know we already kind of talked about a little bit about this, but are there environmental or behavioral or nutritional interventions that we could take that would help mitigate the stress and inflammation that the cats are having? Is there anything that you suggest that cat owners can do to help their cats?
First, keep them engaged. Play, opportunities to explore. Mm-hmm. To interact daily if they like interacting with our cats or animals or people, because not all cats like that, but if they like it, and if they don't like it, provide them places, rooms to stay separate from other individuals. Mm-hmm. Second, reduce stress. Avoid big changes in routine or environment. That could be very important. And provide hiding spots, making sure that the cat knows that they can be safe where they are. Okay? And finally, stay observant. That's very important. Noticing subtle behavioral changes early can help the vet support the cat, before problems grow.
That makes sense. Are there any red flags because I know we talked about also this is often subtle, like what red flags should guardians watch for from a behavioral change perspective, even if their cat seems physically fine?
Yeah, you said it. Watch for changes. Watch for changes. Changes in sleep patterns, confusion, signs of a confusion, vocalizing at night, excessively at least, becoming withdrawer, starting, eliminating outside the litter box, which could simply be a sign of, confusion or disorientation or hesitation to jump or explore. If the cat suddenly seems different, less social, less curious, it is worth talking to the vet. Because these small shifts can be early signs of cognitive aging, which, once again, we can support for.
Right. Looking kind of ahead, is there research that you think would be the most urgent for cat cognition and aging and stress and inflammation, or is there anything that you're planning to do in addition?
Well, I think that longitudinal studies would be definitely welcome.
Yeah.
Yes, because, for example, what we did was to find associations between factors. So we can predict that that is what is likely to happen. But we can't say that one thing causes the other, and causal relationship would be very precious, valuable. And to better understand it and to better support the animal then. Also to have the opportunity to follow to follow the single individual, to see exactly how that individual is aging. That would be the gold standard. And so only longitudinal studies can do that. Only through longitudinal studies you can achieve these results. So I think this should be what is expected what we should do in the future. It's not easy, but we have to.
How might these findings apply to like rescue and foster cats? Because most of them have experienced like so much stress early in their life and like varying environments. Is there extra care that they should be given? Is it just like a waiting for them to settle into a new home? Is there anything special that applies to them?
Yes, that's a great question. First, because I only have rescue cats and dogs.
Yeah.
Actually. So that's a great question. But also because it's very important. Yes, you're right. Early life stress can affect the brain and the immune system in the long term. We know that science has demonstrated that very well. So these cats might be more vulnerable, basically, as adults, which means that they will be even more frail as seniors.
Yeah.
So for them, I think stability is the key. An enriching but predictable environment built around calm, simple routines, gentle handling, the right tools to stimulate them both mentally and physically across all age stages. It's something you have to build as they grow. If you can, if you had that opportunity, and because you live with them, maybe not since when they were born, but maybe you've been living with that cat since the cat was, I don't know, 2, 3, 4. So you have to start supporting them in that sense, so they will become less frail as senior or super senior, as I call them. Super senior is should be a cat like older than 15 years old.
Yeah.
And things like three-dimensional spaces where they can, that can allow the cat to use the space in the 3 dimensions. It enlarges the space, that's the point. So there's much more space if they have the possibility to use it in the 3-dimensional ways. Scratching spots, hiding places, unforced social interactions can really help buffer stress and support cognitive health across all stages of life, particularly in these vulnerable cats.
So you and your colleagues also published on inflammation and behavior changes in dogs and cats on a different paper that was called Inflammation and Behavior Changes in Dogs and Cats. So how do the mechanisms that you see in cats compare to dogs and any other species you may have worked with?
Yes, I probably mentioned that before. The biological mechanisms are pretty the same, pretty similar. Cats and dogs, aging brings immune dysregulation, which is what we call immunosenescence. What does that mean? It means that the immune system becomes less balanced, a lot more pro-inflammatory cytokine and fewer anti-inflammatory cytokines starts to be produced.
Mhm.
Okay, that's similar.
Right.
The very important point is that crucial point is that cats are a bit different in that they tend more to show I mean, they're not demonstrative. They tend not to show off. Okay, even normal behavior, even when they're fine, particularly when they are experiencing some form of discomfort or pain. So in this picture, inflammation related changes may go unnoticed longer. That's why studying inflammaging in cats and educating people, caregivers, and vets about the results of this research is very important because it helps catch those silent early shifts.
Right.
Identify them first and then catch them.
So, how do you envision like a veterinary practice changing around senior cognition and stress and inflammation once they read your paper, once they understand the findings?
I envision a veterinary practice that is more focused on aging and age-related changes, even when routine checkups fall within normal reference ranges. More frequent and targeted follow-ups combining physical and behavioral evaluations could help monitor the parameters, even routine parameters. We were talking about that before.
Right.
Not necessarily, strange cytokines.
Yeah.
Maybe parameters common parameters that may be slowly changing over time. This would allow clinicians to identify emerging inflammation-related patterns earlier and try to counter them or prevent them to develop.
So, if you could give one or two take-home tips to our listeners or cat guardians based on your research to support their older cat's cognition and well-being, what would they be?
Yes, that would be to keep the cat unstressed but engaged, and to stay observant, to keep an eye on that cat, and make sure that the aging cat get regular visits, veterinary visits.
What age do you think people should really start like looking at their cats?
7 years old.
Okay.
Yeah.
Yeah. So from 7 on
At
should really
least from 7.
at least. Okay.
Yeah.
Yeah. That makes sense. Is there a story from your research that illustrates how early detection or intervention made a difference in a cat's life?
Yes. I
Okay.
have it. Okay. I remember one senior cat. She was like a 10-year-old girl. We will call her Mina. That's not her real name, but for privacy reason, I had to change it as well. So Mina, she used to ask for help to open a cupboard where the caregiver used to keep her treats. Very recently, right around the time she was enrolled in our study, she had stopped doing that. And we knew that because we were asking to the caregiver, but she was technically healthy. That's why she was enrolled in our study, because cats had to be healthy by, according to standard veterinary standards for their age. And so she was technically healthy based on her age reference values and showed no apparent clinical signs of disease. Just a slight recent weight loss. But that came up only when the caregiver was directly asked about it. So her caregiver thought, as usually happens, she's just old. But it turned out to be early cognitive signs, early cognitive change. She had what happened was that she had probably started to experience moments of confusion and disorientation, which made her give up more easily in front of a simple problem, like a closed cupboard.
Yeah.
And sometimes she even forget her footballs, where the football was. That's another very common thing.
Yeah.
Which explained the slight weight loss. She kept eating less because she started forgetting where the football was. And that's another way to support the aging cat, adding footballs around the house. Yeah. So if I forget what my football is, there's another one around. I will find it. So with just a few small changes like sunlight but regular mental stimulation and a few extra food bowls placed around the house, she started showing confidence again. She gained weight, and according to the caregiver, at least, she seemed more interested in the world. And that's what early detection can do. It brings back what really matters. That is a life filled with curiosity and positive emotions.
That's great. I love that story. I mean, I don't love that she's in early, cognitive decline, but I love that it was somewhat
That was a cognitive
stabilized.
change.
Yeah.
But being supported when that was just a change and not a real dysfunction,
Right.
we were able to, set it, to fix it.
How old was she? Do you remember?
Yes, she was like 14 years old.
Oh, okay.
Yeah.
Yeah.
But she was fine. And that's not, enrollment in our study was difficult because it's not easy to find healthy cats who are, all the cats who are also totally healthy. Okay, but she was.
Yeah, that's so cool. Well, if you ever need more healthy cats who are old, you just let me know because we've got a lot.
Of course, I will call you. I will give you a call. Be sure. Sure. Especially because you have 14. You said you have 14.
Yeah. And
that's a good sample.
I know. During COVID, I did so many studies just in my house because I was so bored and I couldn't get into my lab. And so I was like, oh, let's do a study with this. Let's do a study with that.
And that's makes me think that there's another thing that I can tell before we say goodbye. That is the approach we used. We used a synchronous citizen science-based approach, which means that our cats were all tested at their home.
That's great.
By their caregiver, but that caregiver was not let alone in doing that. We were there supervising the testing, guiding the caregiver, and making sure that the cat was not getting stressed. That could be also a possibility. Right. And through a simple video call like the one we are having now. And that came into our mind because starting with the COVID limitations, but then we thought, okay, cats are very difficult to move. Transportation is very stressful for cats. Yeah. And that's why studying cats is not easy. If you have to take them to the lab. Yeah. But if they are at home, that makes things much easier for them. So just a couple of them, we have to exclude them from the study because they get stressed. Sure. We could see it, so we stopped the study, we stopped the testing as soon as we got it. We tried another time, like we made another attempt like a couple of weeks later, just to see if it was that time, that day, but it wasn't. And so we had to say this cat just doesn't like it. And since it's not mandatory, we will not involve them. And but apart from this couple of cats, they were all fine. Our cats were not stressed. We have to put all the stress behaviors we considered together to measure them because they were very, 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 very few. So,
sure. In the home, you'd have to weight them together. That makes sense. Well, thank you so much. This was such an interesting, cool discussion, and I'm really excited to read your new paper and then hopefully be able to talk to you again. This was so great. I really enjoyed speaking with you.
It's the same for me. I hope to meet you again very soon.
Thanks for listening. If you enjoyed this episode, please rate and review wherever you listen. It super helps. For more information and to support our podcast, check out our website at hissandtellpodcast.com. You can also find us on Instagram at hissandtellpodcast. Music provided by Cat Beats.